Good morning, everyone. Welcome to the Munson Healthcare Virtual Press Conference. Today is Tuesday, February 23rd, 2021, and my name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare. Next slide, please. As a reminder, we are doing these press conferences in order to keep the community updated on the latest COVID-19 numbers and cases in our region, and also the status of vaccine distribution. I want to remind you that you can also find additional information from Munson Healthcare by signing up for our biweekly newsletter, or you can follow us on social media. Or visit us at munsonhealthcare.org. We do keep a list of FAQs ongoing as we receive new questions and things change related to the pandemic. So I encourage you to follow us or connect with us in one of these ways. Next slide, please. So joining me today is Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. She'll be giving a status of the current case numbers in our region and answering some of our questions we've received recently from reporters. Also joining us today is Dr. Jennifer Morse, who's the Medical Director for District Health Department number 10. New to the press conference today is Dr. Josh Meyerson. He's the Medical Director of the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. So we're excited to have him here today. And then returning as a guest is Wendy Hershenberger, who's the Health Officer for Grand Traverse County Health Department. So let's get things started today. I'd like to introduce Dr. Christine Nefsey.
Thank you, Diane. So we'll go ahead and get started with our numbers, which continue to trend in the right direction. So you can see our cumulative number of cases there, both regionally as well as for the state. The good news is that our percent positive rate and our cases per 100,000 continue to decline and head in the right direction. Next slide. Along with that decline in our number of community cases, we have seen a significant decline in the number of inpatients. We've actually been holding pretty steady for the last 5 days or so, but haven't seen a big bump and are absolutely at a manageable point in the number of inpatient COVID patients that we have across the system. Next slide. And there you can see just longitudinally and graphically where we are. So big uptick and then a gradual decline, another small bump, and then we have been kind of heading down and now are holding steady. Next slide. We did reach a grim and heartbreaking milestone as a country. Overnight, we did crest over 500,000 deaths from COVID-19. This graphic just kind of gives you a picture of what that number looks like. I think sometimes we become a little numb to the numbers, but this is what that graphic looks like for the number of deaths we've had related to COVID-19 compared to our most recent flu outbreaks, as well as some of our world wars. So we have seen a higher number of deaths from COVID-19 than we've seen from World War I, World War II, and Vietnam combined. Next slide. Good news, though, on the vaccine front. We do continue to get vaccine. We continue to work very closely with our health departments to distribute that. I think as a reminder, it's important to understand that the state is allocating that vaccine to us, and all that we have received is already scheduled for either first or second doses. If you did receive your first dose from Munson Healthcare, even though we are not scheduling any additional first dose clinics, you will be receiving your second dose from Munson Healthcare. Next slide. There were some weather impacts globally, well, not globally, nationally, of late, which I'm sure everybody heard of. We're a little bit more used to it than my family down in Texas. And you can see here, doing one of our vaccine clinics in the snow. That being said, while we were able to continue our vaccine clinics despite the weather, it did disrupt some of our supply chain issues. So there was a disruption in how much vaccine the state got because some of those manufacturers are in the South. Next slide. As of yesterday evening, we have, through Munson Healthcare, administered 32,606 vaccines. And I am happy to report 66% of our Munson Healthcare workers are also now vaccinated. So definitely heading in the right direction. Next slide. And I mentioned at an earlier slide that the state is allocating vaccine to us. They are using an algorithm based on a social vulnerability index. So very broadly speaking, they are looking at 4 broad categories. There are 15 total, but basically your socioeconomic status, the composition of your household, some race, ethnicity, and language, and housing transportation issues, and using all of those as a algorithm to go through to really decide who gets how much vaccine and where. And that is really because we know that many of those indices prevent people from having access to general health care and specifically the vaccine. And we want to do everything we can to ensure that we allocate that vaccine equitably across our entire community, regardless of your ability to access it through typical healthcare venues. Next slide. You've probably also heard in the news these variants that we are hearing about. We have seen those variants in the state of Michigan. What we know is that they are likely to be able to spread more easily, though we have not seen any data to support increased virulence from those mutations. That being said, it is really important to continue to stay the course, to wear a mask, maintain your social distancing, avoid those large indoor gatherings, get tested if you have any symptoms at all or risk of exposure, and get vaccinated as soon as you can. And now I will turn it back over to Diane and to our health departments for their updates. Thanks, Diane.
Thank you, Dr. Nefsi. I'd now like to introduce Dr. Jennifer, we'll go to Wendy first. I'm going to introduce Wendy Hershenberger, who's the health officer of the Grand Traverse County Health Department.
Good morning.
Welcome, Wendy.
Thanks for having me back. So I thought I would cover more about our vaccine distribution. I will say in general, as with some of the trends that Dr. Nefsi talked about nationwide, statewide, and even within the Munson system for Grand Traverse County, we are seeing a low percent positivity right now. We're actually at like 2.6%, which is the lowest I've seen it probably in 5 or 6 months. We're averaging, lower numbers, less than 10 cases a day typically in the last week. We did hit a milestone, unfortunately, of over 4,000 cases for Grand Traverse County. We're currently at 4,018, and we do have 65 Grand Traverse County residents who have died from COVID-19. But the good news is with the vaccine, we hope to continue to see these numbers stay low moving forward. But it is really important that everyone still is taking the important mitigation factors, even if you've been vaccinated, continuing to wear masks when you're out in public and around others, staying 6 feet away, kind of the things we've talked about. So if you look at our vaccine distribution progress, I will just say the chart overall shows the clinics for Grand Traverse County Health Department specifically. So you can see kind of early on, the rollout was a little bit slower. That was when we were having clinics at the health department, and it was a very limited group who were eligible, and that was healthcare workers. We are now at the stage we've distributed over 14,500 total doses as a health department. Of those, we're close to 6,000 who are fully vaccinated, so that's a nice step. And I also pulled some numbers from the state health department. They have a vaccine dashboard. And so that actually pulls numbers based on county of residence. And that would include all vaccinations that the health department has given. That would include Munson, it would include nursing homes and others who report to the state registry. And so when I look at those numbers for our population, about 13% of our overall population in Grand Traverse County has been fully vaccinated with the 2 doses. And this week, Grand Traverse County Health Department is really focusing on the 65 plus group. We have a lot in that category to get vaccinated. As of right now, there are 26% of the 65 plus population who have received 2 doses. That's a great step. We do need to try and get closer to that 70% herd immunity number, so you can see we have a ways to go. But we do have this week over 1,200 dose 1 appointments scheduled and another close to 1,700 dose 2. So typically right now we're in a cadence of about 2,400 doses a week that we're vaccinating. I think I'll stop there for my report.
Great. Thank you, Wendy. Always great to have you and to get your update. Next, why don't we take the PowerPoint down, and I will move on to Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome, Dr. Morse.
Hi, thanks for having me. Things are pretty status quo for District Health Department number 10. I don't have our exact numbers right in front of me, but we continue to have vaccination clinics in many of our counties on most days, including Saturdays. Starting mid-March, our focus will start to turn towards having large, more centralized vaccination clinics rotating through different counties. We're still looking for locations to have those, and we'll likely be partnering with the National Guard to do that. That has been a directive from the state to try to focus more on having large clinics rather than having clinics in our health department. So we are working on those plans. We're also starting to reach out to our agricultural workers, to the farms that we have had, and we've had good relationships with them throughout COVID. And so we're starting to make some of those plans as well. So we continue to plug along with our vaccination clinics. So that's
Great.
all I have.
Thank you, Dr. Morse. That's a great update. And now, last but not least, is Dr. Josh Meyerson. Welcome. You're the Medical Director of the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome.
Thank you. Thanks for having me today. Just to tag along there, our update, our focus with vaccination continues to try to maintain, vaccination for our seniors, as well as the workers who fall into those priority categories, with trying to get about 75% of our doses into seniors at 75%, 25% allocation. And we continue to try to make sure that we're being as equitable as we can amongst our counties. We try to have immunization clinics offered somewhere in each county each week. This week, Northwest will be giving over 2,400 doses of vaccine, and Benzie-Leelanau has gotten 700 doses to give this week. So those initiatives are ongoing. I think the other thing is, people can sign up through our website or through our through the senior hotline that's out there. But we do know, and we are looking at ways to make it easier for some people, and to try to figure out how we can make sure that this information is equitably distributed to people throughout our jurisdiction, knowing that some people have more access to internet, some people get their information from Facebook, and others watch network news, and we're trying to look at that so that we can expand the different ways we do disseminate information. And from a case standpoint, our cases have been fairly low. They've been averaging in Northwest, anywhere from single digits to the teens per day, which is really great. We're having definitely less cases than we have been. We have had some outbreaks related to family gatherings, through sports, unfortunately, and we continue to monitor that, especially with new variant that is being found all across the country and in Michigan. Some concern that we don't have, another surge in cases from that. So contact tracing and people staying home if they're sick and getting tested if they have symptoms is still really, really important as we roll out and get more and more people protected through immunization. We're in that transition period, so people really need to be focusing on continuing the mitigation strategies that we're doing. And I think that were the highlights of what I wanted to talk about.
That's great. Thank you, Dr. Meyerson. So I'm going to start the Q&A session. I'm going to bring back all of our panelists today, and we are getting some questions both from the media. If you are logged into the Zoom, you can submit your question using the Q&A feature. And if you are watching elsewhere, you can submit your questions via Facebook and they will reach us today. So I'm going to start with Dr. Meyerson, because you were just mentioning sort of staying the course, and that this is one of the questions that's coming from one of our reporters. What does the low testing positivity rate mean for the public, and what conclusions, if any, can we draw from it, and can we relax a bit now? So if you could just talk about that a little bit more, and also maybe touch on a question I've been receiving a lot, which is, what is the current state of testing in the region, and should people still be seeking testing when they have symptoms?
Well, the quick answer is yes. People certainly, if you have symptoms, if you've been exposed, you should seek testing. And we still recommend that people get tested if there's any concern of being exposed or getting or having COVID-19 disease. So that's still really important. When we look at the percent positivity rates, we look at that. We also have to look at our case counts and how many cases we're having. And certainly if there's, when there's a lot less cases, you're going to have a decrease to some extent in the amount of testing that's being done. Less people being exposed, they're less likely to get tested. But we really also have seen a drop off in testing recently, I think, that is somewhat concerning to me. We still need that surveillance. We are vaccinating, getting doses in arms as quickly as we can. But we still have a long way to go before we have that community immunity where we can really, let our guard down to some extent. So it's still really important that people continue to follow the mitigation measures, and testing is really important, because as we can find cases earlier, we can do that contact tracing and that quarantine, and we can reduce the spread. So just the fact that we've come down from that surge in November and December and January. I mean, I can see people feel a little bit of breathing room, and that's great. But the only way we can keep from going back to that is to keep doing the things that we're doing.
Great, thank you for that answer. The next question is for Wendy. With our Grand Traverse area teachers getting their second doses this past weekend, and 6,000 in the county now with second doses, are we seeing any change in reports of side effects from the second dose? And maybe I'll have Wendy touch on that, and then Dr. Nefsi can also comment on that. Wendy?
Sure. I also just wanted to add on to the testing conversation,
Sure.
Because we have a testing site at Cherryland Center here in Traverse City, and we did bring back testing every Monday and Tuesday from 9 a.m. to 5 p.m. So while we were standing up the mass vaccination site, we did have to pull back a little bit on our testing efforts, but we are partnering with a state partner. And so if people need testing in the region, that's a great consistent resource where they can go.
Great.
Regarding the question on second doses, I don't know that we've heard any, we haven't had any real strong reactions or heard any, seen any real decline in people coming to get second doses at our clinics. We certainly think it's very important that people do continue to get the second dose, even if they're anticipating that they might have, you're naturally probably going to have a greater response in the second dose than you did the first dose, but that actually means that your immune system's kicking in, and it's a good thing. So I guess I'm not sure maybe what the question is.
I think it's really just related to, are we seeing anything new? So Dr. Nefsi, I don't think I've heard of anything that's changed, correct?
Yeah, I mean, really certainly nothing unexpected. And actually, there was just an article that came out today reporting that very rare cases of anaphylaxis, nothing outside what we would normally see with any vaccine that's given. And just the most common things are just feeling fatigued and having a sore arm, which is certainly something you see with many other vaccines. And as Wendy mentioned, these are the same it's the same vaccine that's given in your first and second dose. So there's no change in the vaccine with your second dose, but we would expect that your immune system is a little primed from the first one and that you might have a stronger reaction with your second dose. But that stronger reaction really isn't anything untoward or outside what we would normally expect to see with a vaccine.
Great, thank you both for those answers. Dr. Nefsi, this next question is for you, and it is related to testing. Is it still available and still free? So obviously Wendy just commented on some of the availability, and I'll let the other health departments weigh in as well. But we've seen local clinics now charging for what used to be a free service. What has changed with that? And I'm wondering if that has anything to do with people seeking testing for wanting to travel and maybe not being symptomatic.
Yeah, so there's two things. The testing itself is still free, but if you are evaluated, so say you have symptoms and a provider feels like you need to be evaluated for those symptoms to assess how severe they are, you will be charged for the visit and the assessment and the exam around that. And then there's the asymptomatic testing without exposure or anything like that. There are some places that are providing that as a service, but there is an assessment that is with it. So it's not actually the testing itself. It's typically the assessment around that is being charged.
Got it. Thank you. I was not aware of that. So thank you for that clarification. Dr. Nefsi, I'm going to throw this next one to you as well. It appears there are almost 300,000 vaccine doses allocated to Michigan's long-term care program that are still unused. Have healthcare providers asked the Michigan Department of Health and Human Services to reallocate those doses for quicker distribution to Michigan residents? And I know you're connected with a lot of the conversations happening at the state level.
Yeah, and the reality is that the allocations come from different places. So allocations that are going to the commercial pharmacies are not coming from the state. Those are coming directly from the federal government. And it was the same with the long-term care. So the state was not involved in that. We would love to redistribute unused vaccine to places that we know can give it, but it's out of our hands.
So speaking of redistribution, one more question for you. You indicated that no new vaccine clinics for first doses at Munson Healthcare. Does that mean that Munson Healthcare still is not receiving any additional doses from the state? And can you discuss whether supply is halted or continues in some form?
Yeah, so we are still receiving vaccine, but as we have transitioned from giving that vaccine to a lot of healthcare providers and more to the general public, the state has likewise adjusted the allocation to lean more heavily on health departments and pharmacies to provide that. So we are still getting vaccine. We just aren't getting it in a volume enough to justify standing up a big mass vaccination clinic. So that's why we continue to work with our primary care clinics, our health departments, and anybody else that has the capability of giving the vaccine to give what we can. Now, if we did receive large amount of vaccine from the state, we would certainly reconsider that and look at standing up some mass vax clinics. But right now, the volume that we're getting just doesn't justify that. But we are still getting some. And
Great.
certainly we are getting everything to match a second dose for vaccine we've already given. So I don't want people to worry that we won't be able to give that second dose. We are fully committed and receiving vaccine in order to do that.
Great, thank you. One more question for you, Dr. Nefsi. How does the effort to centralize vaccination clinics at larger venues? So I think, we're hearing from a national scale some of the like Los Angeles, for example, is taking some of their stadiums and doing the mass vax clinics. How does that fit with the equity aims you discussed earlier with the social vulnerability index? Does that dovetail with each other, or are they at odds at all?
I
think that's a good
wouldn't
question.
yeah, I wouldn't say they're at odds. I mean, unless it's part of a transportation issue, and then it could be, although we certainly saw people at our drive-through clinics that had, you know, multiple people kind of carpooling together to come in. You know, the mass vaccination clinics really are something, they work from an efficiency standpoint, getting large numbers of people through. You know, the equity issues we worry about with some of those are scheduling. So if you have to schedule and you need a computer and internet in order to do that, are we adequately providing appointment options for people who don't have that? So the way that we and the health departments have adjusted to that is sometimes we have lists and we call people and we get them scheduled that way. So we are addressing that, but I wouldn't say that those mass vaccination clinics are at odds of that. We just are needing sometimes to adjust in order to get vaccine out to those people. We don't ask people who don't have or who have mobility issues or transportation issues. We look at other ways to get the vaccine to them rather than have them come here. So in that instance, you know, that would maybe be difficult, but for the most part, I don't think they're at odds with each other at all.
Great, thank you. Dr. Meyerson, this next question is for you. Once people have both vaccines, can they mingle safely with each other? I haven't seen my dad in over a year, and I will be getting my second shot this weekend, and he is getting his first on the 9th.
Well, yeah, that's a good question. And there's no perfect answer for that. But first off, when is someone considered fully vaccinated? When do they have that full protection? And what we're using is 14 days after their second dose. So until you're at that point, you're not considered fully vaccinated or fully protected. Once you are there and you're at that point, the vaccines really are effective. And in the clinical trials, they were essentially 100%. They nearly eliminate the risk of severe COVID-19 disease, hospitalization, or deaths. So, and that's really what's important in the long run, for sure. So I think if you have two individuals that are fully vaccinated, someone like, you know, your father, can you spend some time with them? I would say yes, you can. Once you're both at that point, I think you can feel good about that. Can a group of fully vaccinated people, a large group, get together right now? And I would say no. I think we need to follow the same rules. We're not ready to you know, have a dichotomy there, so to speak, within our community, because we're still having, you know, widespread community transmission. And, you know, 95% effective still means 1 out of 20 may get sick. Now, they won't get severely sick and they won't need hospitalization. And that's really great news. These vaccines are effective. But it does mean that that person could get mild illness and still transmit it and pass it on to other people that could include people who are at high risk for severe disease. And none of us want to get our friends or family sick. So that's why even vaccinated people can't have huge parties like it's 2019 yet. We're just not there. We really need to have sustained reduction in community transmission and a higher percent of people who are fully protected. That's what we're all working to. It's what we all want. In the meantime, we still need to keep our gatherings small. We still need to keep face coverings on. And all of us, you know, need to maintain those mitigation measures and then to get vaccinated as soon as we're able to.
Great. Thank you, Dr. Meyerson. This is a question, I'm not sure if the health departments or if Dr. Nefsi, if you want to comment on this, but the question is, why did vaccine that probably this person thinks should have been given to Northern Michigan get diverted to other counties? So Dr. Nefsi, you were just touching on this related to the social vulnerability index, but isn't it also because, there are other counties that were hit a lot harder than Northern Michigan when the pandemic first hit?
Absolutely. I mean, so certainly there's, how many people do you have? So they're going to do it proportionally. If you have, so the population dense areas in Southern Michigan are going to get more vaccine than we do. They have more people. So we're looking at a percentage. And one of the things the state is also looking at is how hard hit those areas were. So as you mentioned, Diane, Southern Michigan got hit much, much harder than we did with the waves of COVID that we saw. So that would, again, allocate more vaccine to them as a preventive measure. But, it's definitely population based, but also some of those other things, the socioeconomic status, the ethnicity, that makeup. So there's a lot of different things that go in, but they're applying that algorithm fairly and then, distributing vaccine as that goes.
So Dr. Nefsi, speaking of that, we were in tier 1A, we're in tier 1B. Has anything changed with the tiers? Because we're getting some questions about when can we move to tier 1C, but I do believe that there was recently some changes to tier 1B or expansion of some of that criteria, correct?
Yeah, the plan is on March 1st to expand the tiers a bit. And so not only would the age be lowered to 60 if you have risk factors. So those risk factors we've already kind of talked about as far as your vulnerability, and also to agricultural workers. So people who are farmers, are food production people. So people that, help us put food on the table, through food processing, whether that's meat, dairy, vegetables, fruit, that kind of thing. People that do beverage production and animal feed, and all of those people that really do the foundational work to get food on our tables will be included in the tier starting on March 1st.
Great, thank you. Dr. Morse, this next question is for you. Do you know any of the status of any of the additional vaccines that might be available, such as Johnson & Johnson or AstraZeneca that we originally heard about?
Johnson & Johnson will go for emergency use authorization on Friday with the FDA, and then I believe Saturday, the CDC, the ACIP will discuss their recommendations. So we should know by next week what the plan is with Johnson & Johnson, but I was actually on a call with the state this morning, and they really don't know much detail about Johnson & Johnson at this point. So we're really waiting for the FDA and the ACIP to meet. So hopefully soon after that, we'll have lots of detail, lots of information of when that will be forthcoming, and really their recommendations as to who that vaccine should be prioritized towards, and how we can really differentiate, should different vaccines be utilized for different people, how we're gonna fit that into our vaccination plans. There really has not been a lot of new information that I have seen lately on the AstraZeneca vaccination, and it may just be that I haven't seen it, but the ACIP did discuss it in a meeting, I believe about a month ago, and I really have not seen much since then. And as far as I am aware, they do not have a meeting set up with the FDA for emergency use authorization. So unless someone else might know something different, but I have not. Okay, Dr. Nefsi is shaking her head. I have not heard anything new, and I know there were some details about their research that was being asked to be clarified, but so it was looking like Johnson & Johnson. Hopefully, by the time you guys have your next press conference, you will have a lot of new information to provide. So fingers crossed, we will see some increasing in supply of a new vaccine.
Great. And one more question for you, Dr. Morse. Do we know at all when restaurant workers may be able to be vaccinated or fall into one of the tiers? I don't have a specific date, but looking at the timeline that I have from the state, I'm just scrolling through it right now. Other frontline essential workers are targeted to begin in May. And I believe, if I'm reading correctly, that they may be included in that. I know grocery store workers are. So
I'm not sure if they will be included in that or not, but it looks like May right now may be when they are targeted. If not, then all remaining essential workers are, it looks like they're targeted for late summer. As we have all seen throughout all of this, it's subject to change. So things that are in writing right now might be in flux based on our vaccine supply and, based on our goals for keeping things open or where things are being affected. So it is really hard to put a pin on that, but I think the projections now are, earliest May through the summer sometime.
Great, thank you. And I know none of us have a crystal ball, but yes, we are
Yeah.
getting a lot. We're getting a lot of questions, such as, will those with high risk factors, 16 to 65, be prioritized after the March 1st expansion? I don't know if we know that. So do we, Dr. Nefsi?
I mean, yes, but we just don't know when.
Or how, right?
Yeah, that could be as far out as Dr. Morse alluded to as the, April, May, June. We just don't know when. And again, it really does, the way that the state, I think, is selecting to move forward is how much vaccine and what percentage we have of people. So when we had most of our healthcare workers and long-term care workers and residents done, that's when we moved to the next tier. And so that's really how they're looking at it. And much of that does depend on how much vaccine we have. So we just don't have that information yet.
All right, this next question I'm going to ask of Wendy. When do you think people who want to be vaccinated will be fully vaccinated in our area and travel being allowed again? And I think we've been touching on that for the last couple of questions here, and that timeline still takes us through December, correct?
Correct. Yeah, it's, as soon as we can is the answer, and as soon as the vaccine allotment allows. And that's, I think, what's hard for all of us is we certainly know that we have more capacity at our local health departments and hospitals to vaccinate more than the current supply that we're receiving. Like I said, just for our county alone, we're about a little over 25% of our 65 plus population. So we have a ways to go with that population before we really, can start concentrating on the next groups as well. And I know we get questions every day, we all do. And there's a lot of people waiting, and we understand that, and we are doing our best to just get the vaccine out as quickly as we get it. And I would say it's probably going to be a good 6 to 9 months before we're, approaching that herd immunity number, that target number.
Thank you, Wendy. Dr. Nefsi, can you explain a little bit more about what an underlying health condition means as part of this vaccination tiering?
Well, again, what we know right now is the social vulnerability index talks about things like your socioeconomic status. So if you're below the poverty level, if you are a member of an ethnic minority, if you live in a single parent household, or if you have somebody, adult or child with disabilities, all of those things are part of that social vulnerability index that's being used. That's a little bit different than, a medical reason. And, that certainly we're hearing a lot of pressure from our physician colleagues, and that is absolutely a tier. So you have, kids 16 and up that have medical problems, but those things that put you at high risk for developing serious illness from COVID. So all those things that we used to talk about early on, high blood pressure, diabetes, heart disease, those kinds of things, chronic pulmonary disease, those are all health factors that would be part of that. So, right now that 60 and up is with a social vulnerability index. And certainly there are things with a chronic illness that often overlap with those. But that right now is what the tier is. Then after that will be health risks.
Great. Thank you, Dr. Nefsi. And one more question for you. What should someone do if they are currently on a blood thinner and are wondering if they should get their second vaccine dose this Friday?
you know, it would be hard to know if they were on a blood thinner before when they got their first dose, but I would say that's a conversation to have with your primary care physician or your cardiologist or whoever about, you know, what your numbers are. That's a very individual question and specific to a lot of other clinical factors. So I would have the conversation with either your primary care doctor or your specialist about whether, depending on what your numbers are, it's safe for you to have that vaccine. Typically it would be, but that's a conversation for them to have with their doctor.
Right, but just as a disclaimer, we can't give medical advice on this press conference. So definitely anyone who has a question about either an underlying condition or a specific question related to the vaccine dose should seek the advice of their own medical provider. So
absolutely, yep.
Thank you. All right, the last question here, I think we've covered just about every question that's come in today, except there was one about, can we get the slides that Dr. Nefsi presented? And the answer to that is yes. We will make those available on our website, munsonhealthcare.org, in the newsroom section under our COVID-19 area, along with a recording of this press conference, so you can view it again. And I don't think we have any other questions coming in, so I would like to thank all of our panelists today. And as a reminder, Munson Healthcare will also be having another press conference next Tuesday, and then we will have representatives from our health departments here back again in a couple of weeks to talk about any of the latest updates they have. So thank you, everyone, and have a great afternoon.
Thanks, Diane.